Hi, welcome to my presentation on depression. Today is September 14th, 2015. One type of depression is the major depressive disorder. That is diagnosed when a person exhibits symptoms for 2 weeks or longer and includes at least 5 of the following symptoms. 5 of those symptoms can include depressed mood for most of the day, anhedonia, a significant change in body weight that is unintentional, daily hypersomnia or insomnia, or fatigue or loss of energy throughout the day. Some other symptoms of depression can include feelings of worthlessness, excessive or inappropriate guilt towards a situation, psychomotor retardation or agitation, impaired cognition, or recurrent thoughts of suicide and death. To properly diagnose depression, other symptoms must include significant distress or impairment in social, occupational, or other areas of functioning. And it must not be due to the effects of any drugs or medication being taken by that person. And they may also not be due to a general medical condition. Signs to look out for in someone that may be depressed are change in appetite, if they self-criticize often, if they have a decrease in concentration. For a student, one might show failing grades or promiscuity in teenagers or young adults, or even older adults for that matter. If someone is not necessarily a risk taker and now they are participating in risk-taking activities. There are multiple patient programs that an individual can enroll in to help with depression. Some of these programs are either patient participation-based or interpersonal psychotherapy. They have school-based programs that can also be provided in additional settings. 2 of the programs that I found that a person can be treated for depression would be the Penn Resilience Program, PRP, and the Coping with Stress Program. One program, the Penn Resilience Program, is delivered usually in schools that utilize what is called a CBT to educate kids about the connection between their beliefs or life events, about the emotional consequences that happen in these life events, and teach them how to deal with. The Coping with Stress Program is an educational group program developed to help younger adults who may be at risk for depression. It's used to control their negative moods, properly deal with conflicts with their family and friends, and change any type of thought patterns that they have. And depression with men and women can vary, along with being quite similar. Women may experience more symptoms like crying or sadness, or have lack of energy, or may not be that interested in sex anymore, or have a hard time at work dealing with something. Men usually have symptoms such as health deterioration, maybe gaining or losing weight, or they exhibit pain in certain areas of their bodies.